Neck pain from a pinched nerve can be unbearable. But don't worry, this video is here to help with simple yet effective exercises that can help provide you with the relief you've been searching for. In this video, I'm going to be going over 3 effective methods that you can use to provide instant relief for pain from a pinched nerve in the neck. Not only am I going to go over these techniques, but I'll also describe what a pinched nerve is and why it can cause so much pain. I'm Dr. Daniel Bridge. I'm a chiropractor in Helena, Montana. This channel is dedicated to teaching you tips and strategies on how to maintain a healthy spine and how to live a pain-free life. Many people suffer from a pinched nerve in the neck. Now, in my office we call it cervical radiculopathy because it's not always clear that you're getting physical compression on the nerve, but regardless, the symptoms typically include pain in the neck, into the trap, into the shoulder, down into the arm, even down into the lower arm and into the hand. It can include numbness, tingling, weakness, burning. It's very debilitating. It can really interrupt somebody's sleep. It can make it hard to play sports, to effectively do your work, pick up kids. So it's very important that you have a proper diagnosis. And this is one of those things that can oftentimes get missed. With the proper diagnosis, we're able to apply the proper treatment, which can oftentimes resolve this problem without needing more invasive treatments. That being said, oftentimes there's things that you can do at home that can provide instant relief for this very debilitating problem. So we're going to go over 3 of those techniques in this video. Let's get started. The first thing I'm going to show you is called a chin tuck. Oftentimes this one you can get instant relief. So what you're going to do is you're going to stand up nice and tall with good posture, and you're going to tuck your chin to give yourself a double chin. So it looks like this from the side, mouth closed. Then you're going to slide your head backwards, and the trick is to slide backwards. You don't want to lean backwards, you don't want to lean too far forward. So you're tucking your chin, you can put your fingers on your chin, and then you're sliding backwards. And you hold it for 3 to 5 seconds. And then you repeat that 10 times. So you would repeat this. Ten times. You take a break, you take a couple minute break, and what you're looking for is, where is the pain on my arm? If it started all the way down to your fingers and you do 10 of those and all of a sudden it's mid-arm, that's progress, because what we're looking for is what we call centralization, bringing the pain from the outside into the center. You can repeat this 3 to 10 times a day. Another way you can do it is you can go up against the wall, place your shoulder blades and your butt against the wall, and that's going to prevent your body from moving. And then same thing, tuck and bring it back up to 10 times a day. The second strategy we're going to go over is a nerve flossing exercise. So what you're going to do is you're going to bring the affected arm, so if I'm having pain on this side, I'm going to bring it out to the side, and I'm going to tuck my ear to my shoulder of that side. And then what I'm going to do is I'm going to bring that out, straighten it up, and as I'm doing that, I'm putting slack into that nervous system by bending this elbow. And then I keep bringing my left ear to my left shoulder as I keep bending my arm forward, ultimately bending my wrist. And then you go back. You can even extend your wrist and forth. That also can be 10 repetitions of that. You can do that 3 times a day. What that's doing is that's flossing the nerve. You're tractioning it out this way, and then you're bringing it back this way. And it's gliding through there, and that can help to rid itself of adhesions that can be causing a lot of that radiculopathy that we discussed. The third strategy we're going to go over today is called cervical decompression. Now, when you have a disc bulge or something that's compressing on that nerve, an effective treatment is to decompress that area. So in my office, we have 2 decompression tables. We use them every day, and they're very effective at helping my patients decompress the cervical spine and get the pressure off the nerve. Now, obviously, you don't have one of those at home, but here's something that you can do that can provide some decompression to your neck, that can potentially be one of those things that can help to provide you some relief. It's probably not going to fix the problem, but it can provide you some of that instant relief that we talked about. So what you're going to do is you're going to get a small towel, and you're going to wrap it around your neck, and you slightly lean your head backwards just so you can get a good grip of that towel under your skull. And then you're just going to pull straight up, or maybe at a 45-degree angle. And you can play around with the angle because you'll feel it. You'll feel it getting that stretch, and you'll know what will feel good. So you might try going a little higher, straight up, and you can just hold that stretch. It feels really good. Also, if you lean your head one way or the other, you can also get a different target that you're stretching and you're decompressing. Now, you're dealing with the neck, especially if you have an injury. You want to go light. If this starts making the problem worse at all, you obviously want to discontinue it. Thanks for watching. Hopefully some of these tips helped. If you have any questions, don't hesitate to leave them in the comments section. I'll make sure to get those answered. And I'd really appreciate it if you liked and subscribed to our channel just so you don't miss any future tips. We can help keeping your spine healthy and keeping you pain-free.